Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. We are from the group of discuss. We are going to tell you about the result of our reading discussion. Let me introduce ourselves. First, Nurfitri Alfajeh, 20 and 80. Second is Nasugrova, 20 and 81. Third, Putri Pujirahayu, 20 and 83. Fourth, Riza Malia F, 20 and 84. And last, Nintang dari Septantia, 20 and 85. Rule 1. Connector. The well-being and emotional resilience of healthcare work are a key component of maintaining essential healthcare service during the COVID-19 virus or coronavirus outbreak. Therefore, it will be crucial to anticipate the stress associated will, with this work and put the place support for healthcare work. Monitoring and assessment of mental health and well-being healthcare personnel will be important, along with effort to ensure their successful reintegration with work colleagues, so they doesn't become infected. Both institutional support and self-care strategies are important. Stress in healthcare work during the outbreak. There are specific sources of stress for healthcare work treat patients with the COVID-19 virus. These stressors include need to employ strict biosecurity measures, healthcare work were called upon to assist or treat those with COVID-19 might experience stress related to physical strain of protective equipment, dehydration, head exhaustion, physical isolation, restriction on touching others, even after working hours, constant awareness and vigilance regarding infection control procedure, pressure regarding procedure that must be followed, lack of spontaneity, risk of disease transmission. The text above relates to the text that has been presented by Ms. Fitri because it has the same meaning. The health work during the COVID pandemic really need coping strategies to avoid stress.
And the next is role 2, passenger picker. Last paragraph in the second sentence. The study indicates that for healthcare workers in Indonesia, family support is the main factor that motivates healthcare workers to provide healthcare service during the COVID-19 outbreak. So it is important to provide the opportunities for healthcare workers to make contact and gather with families to provide mutual support. We choose this part because it is sad or emotional. The health workers know they might meet their family again, but in the otherwise, they must do their job as a professional health workers because it is the way they could save their family either. They are our heroes.
Role 3, Summarizer. The most significant stressor for health workers was the requirement to wear personal protective equipment or PPE every day. However, using PPE every day causes discomfort, so that it becomes a stressor for health workers. The discomforts of using PPE include adverse skin reaction, difficulty breathing, head stress, dizziness, and nausea. One strategy that can be taken to overcome these problems is to provide adequate PPE training to increase safety and comfort. The main factor that reduced their stress was that all health professionals worked together on the front lines to overcome COVID-19. good collaboration between professionals, effective preventive measures, and a positive attitude when dealing with the pandemic also play an important role in reducing stress. The three coping strategies most commonly used by health workers to deal with the COVID-19 outbreak were: first, adopting a positive attitude to motivate themselves; two, reading about COVID-19 and its prevention and transmission; three, and following appropriate self-protection measures. The motivation for health workers in facing a pandemic is family support, self-awareness of the obligation as health workers to provide the best health service during the COVID-19 pandemic, and appreciate that the hospitals gave special reward for the work they were doing.
Rule 4. Word Wizard 1. Examine. In Indonesia, memeriksa means look carefully to know the situation. 2. Average. In Indonesia is rata-rata means a statistic that shows the most common or intermediate value of the random variable has been measured. 3. Ethical obligation. In Indonesia, kewajiban etik means something that must be carried out in accordance with professional ethics. The next, invaluable. In Indonesia, tidak ternilai means the value is not estimated. Next, dizziness. In Indonesia is pusing means in a state of balance disturbed and as if the surrounding were spinning. 6. Nausea. In Indonesia is mual means want to remove or regarding food or drink that has entered the mouth or stomach. And the last, outbreak. In Indonesia is kejadian luar biasa means unexpected and surprising events.
Next, Rule 5, Discussion Director. We have 5 questions based on the text. First question is, what is the main purpose of the study of stressor, coping mechanism, and motivation among healthcare workers in dealing with stress due to the COVID-19 pandemic in Indonesia? Second question is, who is the main significant factor that motivates the health workers to deal with the COVID-19 outbreak? Third question is, where is the writer of the text got the further information for this study? Fourth question is, why is it discomfort and being a stressor of the health workers for using PPE or personal protective equipment every day? Fifth question is, how is the health workers using their 3 coping strategies? That's all from our presentation. This has been third group of this class. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.